Hello, welcome to this new podcast of the American Journal of Public Health. We are at the annual meeting of the American Public Health Association, and we looked at the program and we found so many interesting topics, and some very different from what we cover usually in the podcast or in the journal. And so we invited these people to tell us why they do what they do, and why it is important. So this one, you found it, Vickie.
I found it,
What you-
and I have to say, maybe I had a bias because I'm from Chicago, and David Rein, who is our guest for this podcast, is with the National Opinion Research Center at the University of Chicago. It's known as NORC for those of us who are in the inner circle.
Thanks. Yeah, no, it's my pleasure to be here. I'm so glad that you found the abstract interesting. We had a really interesting presentation this morning that was well attended. And I think the main thing that we're trying to get across, like if you get nothing else out of watching this podcast, is that we think vision health is really an important component of public health in general, and can be a marker for other conditions. And also, what we're trying to do is use a special question that's in the American Community Survey, which is really a very valuable survey, but doesn't have that many health questions in it, to be able to understand people with vision problems better and help people design interventions and outreach efforts to help those people.
The reason I picked this is because we don't often get to talk about vision, and often people are like, vision and dental, not in their health plans necessarily. And so vision is really very important. I mean, for young kids, it's the start of whether they do well in school, do they need glasses? And for those who are older, it's a question of, their vision and do they fall? So talk to me about the importance of vision to America as a public health issue.
So I think that's exactly right. And one thing that you mentioned that's particularly important to keep in mind is vision creates different issues and challenges at different ages. So for children, you're really talking about issues of developmental delays, social isolation. Think about kids, like can't even play ball on the field with their classmates because of their vision. Your heart goes out to children experiencing that, especially when there are things that we can do to intervene and help them, many of which are low cost and relatively easy to implement. With working age adults, there's different problems. So some people are limited in the types of work that they can do. Some people feel inhibited about going out and about in their communities, and experience social isolation because of their vision. And many people, especially in working age adults, are walking around with functional vision impairment. So what you and I would consider to be visually impaired, with a condition called uncorrected refractive error, which really means that they either can't access or don't have the ability to get the right glasses or contact lenses. So research shows that as much as 80% or higher of all vision impairment in America could potentially be corrected just by properly screening people for vision problems and giving appropriate glasses or contact lenses. And then, of course, the largest group of people with vision problems are older adults. We all experience this as we get older. I'm wearing glasses now. I didn't always wear glasses. I see you're wearing glasses too. Pretty much everyone our age wears glasses. And as you get older, not just your ability to focus on near objects, which is called presbyopia, begins to occur, but you begin to experience more and more eye disease, which results in permanent uncorrectable vision impairment in many cases, or age-related cataracts, which can entirely obscure vision, but also can be corrected with simple surgical interventions.
So David, this is clearly an important public health problem. We don't see much coming at the journal, maybe because they go to more specialized journal. But there is one aspect in your presentation which is very central to the mission of the journal, which is health monitoring. And your project is about health monitoring of vision problems. So can you tell us, how do we monitor those problems today, and how would your project change this and improve that?
Yeah, absolutely. So this work is all possible because of cooperative agreement supported funding from the Centers for Disease Control and Prevention under what's called the Vision and Eye Health Surveillance System, for which I have the privilege of being the principal investigator. The mission of the Vision and Eye Health Surveillance System is to compile information from different sources to give us the best possible picture of vision impairment and blindness, and also the eye diseases and eye disorders that cause it in the United States. Like many chronic conditions, and many conditions now, the public health atmosphere and funding availability just doesn't have the resources for traditional case identification, surveillance efforts, and registries. So, what the Vision Eye Health Surveillance System, or VESS, attempts to do is identify different indicators from different sources, such as the Medicare and Medicaid data, from national survey data, from health registry data, and combine those sources to give a varied picture of vision problems at different geographic levels. For this project, there's one resource, which is the American Community Survey, which is operated by the U.S. Census Bureau and is a national treasure in terms of the sample size that it can deliver. And the reason why that's important from a public health perspective is it allows us to see problems at a very granular level, which is something that we hear from public health professionals all the time. You have all this great data at the county level, but really, like, I work in Los Angeles, I work in Atlanta, I work in New York City, and we really need to know, which specific neighborhoods are experiencing the problem so that we can do something about it. If you think just about Los Angeles County with 10 million people has more people in it than 40 other states in the United States of America. So a county level estimate for Los Angeles doesn't really do a ton for you in terms of targeting public health resources. So because of the Americans with Disability Act, the American Community Survey includes 6 disability questions, one of which measures self-reported vision problems. And using this data source, we can measure the prevalence of vision problems at a very granular level, in this case, the census tract, and then we can apply different methods to it to try to find out more about the characteristics of the people who are experiencing vision problems.
Let me just ask you about that data because it's, the American Community Survey, it's wonderful when people fill it out. As you said, it's a treasure. What is it that you think you'll be able to do with this data that will help communities?
So what we hope to be able to do is create an exploratory data platform. In addition to having
What was that?
what? So I'm going to explain what that is. So basically, it's going to be a website with a map where you can view the data from different levels. The ACS is very vast and rich, but it's too much data for most people to ingest and look at. And what we're hoping public health professionals will be able to do is take a very bird's eye view. Like, let's think about Los Angeles again. So look at all of California, see the prevalence of vision problems and the types of people with vision problems in California, then zoom in to the county level, let's say Los Angeles, see Los Angeles as a whole compared to the counties around it, and then actually go deeper into Los Angeles and look at the different neighborhoods in Los Angeles and see, which areas have the highest prevalence of vision problems. Then if you have an idea, right, okay, so this is an area that's near where my public health office is, or this is an area where I operate in, you can go to specific neighborhoods, in this case measured by data at the census tract level, click on them, understand what types of people with vision problems are living in each of these different census tracts, and then also relate that information to census tract level information about percentage of people who are living in poverty, access to optometrists and ophthalmology care in that area, levels of education, walkability. So we've got the census tract level walk score in there. Or all sorts of different information which people who understand the areas best can use to design interventions and programs to help people with vision problems.
Since I'm in LA County, I love the idea. But anyway, I just want people to understand we'll never know the particular person. We'll just know the prevalence of certain things in particular areas. And what that should really help with, if I have it straight, is that LA County or LA City or wherever we are would then be able to say, let us see whether or not we have adequate resources in this area. Let us see whether or not motor vehicle accidents or, kind of the walkability scores, which we see with our real estate, whether or not those things tell us, are some people being advantaged or disadvantaged because they don't have those resources to enable them to be able to, kind of function in those kind of areas that aren't walkable and stuff. Is that more
That's
what we do?
exactly right. So I
Yeah.
want to make one point. We are not looking at individual records from individual people. All of our estimates at the census tract level are just that. They're estimates made using a method called microsimulation. So you can't identify anyone from these data, nor would we want you to identify anyone from these data. But the idea is exactly what you said, to use these estimates to understand neighborhood by neighborhood differences in complex environments like an urban environment or a very large rural area, and understand the places where you're likely to have the best success for the types of projects and programs that you operate to succeed given the characteristics of those neighborhoods. Also, like where it's most needed, right? So this is an attempt to, we're always pushing. There's a lot of really excellent research. We've conducted this research in our group, and I think it's important and should continue. But there's a lot of research. That said, there's a lot of research on the associations between, what we call now social determinants of health and health outcomes, which are very important for understanding the risk factors for disorders and the barriers and facilitators that people are facing. What we're attempting to do in this project, which is really an experiment because we haven't made a map like this before, is to try to push further and use that information to direct actual public health resources towards the places that are experiencing disadvantages in order to address, some pretty large public health issues with vision health.
So it'll be vision equity.
That's what we're hoping, yeah.
I want to bring, this conversation is a lot about professionals. Let me ask you, David. I love this, the model, and I think probably it could be a model for exploring other major public health issues that on which we have little information, such granular, information. But how are you going to make sure that the people in the census can access this information and understand it?
So that's a good question. We put our materials online. I think dissemination is an incredibly important aspect of any public health research that really has a public health focus. So, for example, sitting down with you today is a way to help raise awareness that this tool is available for people who use it. We can create all sorts of information. We can do all sorts of studies. And if they sit in a journal and only show up when people reference them in their introduction section or their conclusion section, they're potentially not impacting public health. So what we really want is to engage those people who have the most need to use the information. And to be honest, we don't know who's really going to benefit and use these data the most, right? So we come at this from a public health perspective, working under a CDC-funded cooperative agreement. So the assumption is the people who are going to use these data the most will be public health departments, state and local public health departments. Those are the ones that have been telling us that VEST needs more granular data to look within urban areas. But that's not necessarily the case. It may be there's an optometry office that's decides to take a public health approach and really wants to know what the needs are for people in their area and wants to reach out to people in the neighborhoods that surround their optometry offices. That's good for their business, good for the people who live there, and also provides the type of information that the people who are doing the outreach need to understand who they're trying to contact, reach, and what their possible needs might be.
Let me just ask you a question because one of the things I do know about Newark, having lived in Chicago, is that you have some studies where you have community advisory boards where you actually are with the community to kind of push it out. Do you think there's any possibility that you all might be able to share this with communities, in some way of giving mappings out or, calling in community groups to learn about this? Because I don't think that a lot of people are really tuned in about, vision and how there are inequities in vision. So you all might be able to be some pioneers. So what are your thoughts?
It's an excellent idea. I think community advisory boards are a fantastic resource. We do not have one on this project. We do have an expert advisory consultant group made up of public health ophthalmologists and optometrists who provide advice about what's likely to be useful to their community. But I think that you're absolutely right, particularly as we roll the tool out and want to work with individual stakeholders, it's very important for them to hear from us about what the tool is, how it can be used in different communities, and it's equally as important for us to hear from them about what's working for them with the tool and what's not working with the tool so that we can improve it over time.
Great.
David, thank you very much. Thank you for your time. It's a fascinating project. You selected very well, Vickie, as usual. But it has such a great potential for vision, but also maybe for other problems, hearing and whatever So thank you for being with us in this podcast. Today we had David Rein from Newark in the University of Chicago, and with Vickie Mays.
From UCLA.
Bye bye, everybody.